gotta testify. Come up in the spot looking extra fly. For the day I die, I'ma touch the sky. Gotta testify. Come up in the spot looking extra fly. For the day I die, I'ma touch the sky.
Hi everyone, welcome back to my channel, or welcome if you are new. My name is Christian Foster. I am a final year medical student studying at the University of the West Indies Mona campus in Jamaica. And in today's video, I'll be speaking about 5 things I wish I knew or that nobody can prepare you for before you get to clinicals. Now, whilst I would have loved to say a million other things, I tried to condense it to 5 main things that I think nobody really could have prepared me for. Like, no matter how much anybody tell me about this, I really wouldn't understand it until I finally reached into the program itself and got to clinicals. So the very first thing is that you're gonna be more tired than you have ever been in your life. And I really don't mean this to be like an exaggeration, but when comparing it to pre-clin, there are so many factors that contribute to you just perpetually being tired all the time. So everybody knows that a lot of medical students complain about the fact that they don't really have time for themselves and that there's a lot of work to cover. But the reality is, when you're in pre-clin, you actually have a lot more time on your hands. For instance, you don't have to be at school before 8 o'clock. You get to school at 8 and school is supposed to finish at 4. Yeah, you might have a lab that runs late, but most times school is from 8 to 4. You actually have a lot more free time afterwards, in terms of you don't really have any responsibilities. Like, for instance, in clinicals you might have a duty, but you don't really have certain responsibilities in pre-clin. So you really and truly, like, you have to study a lot, definitely, but you have a lot more time. It's just management of it, right? So that is one thing. Like, clinicals, a lot of your time is like, for instance, like for me, I go to school in Clarendon every day. I have to basically get up 5 o'clock and then I'm getting home at 6, which means if I want to go to the gym, that's already 2 hours out of my schedule. And then by the time I get home, it's after 8:30 and I have to eat, settle down, and then start studying. And I also need to get proper sleep. Just do the maths, you're tired. You are gonna be extremely tired. Another big aspect of why I think a lot of medical students are like perpetually tired is, even when we manage our time properly, there is this feeling of I'm underachieving or I'm not doing enough. And we always feel like we need to study more than the number of hours that our brain can possibly even retain information. And that contributes to just a lot of like really poor sleep hygiene and really bad eating habits and just overall bad habits that can contribute to you as well not getting good sleep. And yeah, it's a really sad cycle, but it's like nobody can really like obviously everybody tells you, yeah man, you go be like super tired all the time, like it's a lot of work and stuff, but you don't really feel it until you actually are like, you have rotations and you realize, yo, I need to get up early, I need to study a little bit before I go to school. When I go to school, I have to be performing. When I get home, I have to eat, go to gym, I have to exercise, I have to do this and that. And then you basically don't even really have like time for this. The only time you really get to yourself is the weekend, which I am extremely grateful for, because if I didn't have my weekends, that's like, boy, internship, it could be rough working on weekends, because I really love my weekends to just reset and, you know, try and tackle the next week. But boy, you are gonna be tired. But that's not to say you can't enjoy life and you can't, you know, have a life outside of school. It's just that you genuinely are gonna feel, you know, you're just gonna feel exhausted all the time. Alright, so the second thing that nobody can really prepare you for is that most of your learning is actually gonna be done in the form of something called pimping. So for those of you who don't know what pimping is, it's basically like somebody putting you on the spot and just asking you a question that you didn't know they were gonna ask you, whether or not you're prepared. Let me give you an example. Alright, so good morning everybody. This is AD, a 12-month-old infant with a 4-day history of bilious non-projectile vomiting, Mother complains of abdominal pain that comes and goes, and she also says that she noted some blood in his diaper mixed with mucus for the last 2 days. Alright, thank you, Doc. Before you continue, medical students, what y'all think about this patient's presentation? You, Foster, what do you think? Okay, so I think based on this patient's presentation, I would like to consider differential of interception. Okay, what is interception?
Three hours later.
Hydrostatic reduction 3 times before operation of a surgical manipulation is indicated. Okay, what else? Excuse me? But you don't start yet. What else? That's it? Boy, when I was in medical school. So that is basically what water runs looks like on a daily basis. A lot of people hate this. I feel like majority of medical students hate being pimped. They hate being asked questions on the spot. Now I'm gonna be honest, when I just started clinical, so not necessarily when I started my actual rotations, but when we started something called IMP, so in Jamaica we do something called Introduction to Medical Practice. You actually started in 1st and 2nd year, but in 3rd year we get 4 weeks in the hospital where we rotate through medicine and surgery, and we get a little bit of exposure without that type of rigorous, pimping type of style thing. We don't have exams, nothing like that. It's just a month in the hospital where we get exposed. It's an introduction. So my first experience with pimping was when I was on my surgery portion of IMP, and I literally vividly remember the consultant asking me, the very first question I remember being asked was, what are the branches of the superior mesenteric artery? Now, I'm somebody, I love digestive anatomy. I love the arteries, I love the vessels, I just love everything about it. And the embryology associated with it. But I don't know why, in my head, I was just like, I had never experienced feeling like that. Like what? Like why? I felt so pressured because you're in front of patients, doctors, consultants, other students, your friends. So it's like super duper nerve wracking. But then as the rotations went on, like 3rd year, 4th year, and then now final year, I'm realizing that I actually really like being pimped. It depends though. So like 90% of the time, the consultants, it's just their method of they want you to learn. It's their method of trying to teach you. So sometimes they don't want to take the easy way and just tell you what it is. They want you to try and figure it out, because the fact is, we know a lot of the basic principles, we just may not know it at a certain level that they do, because obviously they need specialty training for it. So I think they try their best to just get it out of you, and if you can't figure it out, they will help you out. But there's a small minute 10% of them that they may actually want to tear you down, But for the most part, it's you have to see the beauty in it. Those certain consultants, that 10%, you just have to pay them no mind, and if they're purposely targeting you and stuff, you're gonna be off that rotation in some weeks. But the ones who are working with you, the ones who see your potential, and the ones who particularly try and get you to say things, you have to take that, you have to be appreciative of it, because at the end of the day, we're learning to treat patients, but we're also studying for our exams. We're also learning for our exams, and they want you to do well on those exams, most of them. So at first, I was a little timid about it, but I'm not a naturally timid person. I like to talk, and obviously. And so I started seeing it to my benefit. I was like, yeah man, this can actually help me, So yeah, you have to really be, not be too scared about the pimping and stuff, because really and truly, after you get it wrong, you're gonna learn from it. That's how we learn as humans. You understand? We learn through mistakes. And experience is the best teacher. You're not gonna, if you didn't go to school that day and you didn't get pimped and you were trying to avoid it, you probably wouldn't have learned that by reading. So yeah, but nobody can really prepare you for it. It is a very, very nerve-wracking experience, but once you get used to it, you see it to your benefit. All right, so the third thing is that nobody is ever going to tell you what you have to do. You are a big person. Now let me explain. So like when I just started medical school, I always thought that like, I don't know why I had this notion that it was just this super duper like strict, overly like, you know, you have to be here at this time and you have to be like, I don't know if from a movie or like a show, I don't know what I thought. I just always thought that they were telling you have to be here at this time and you have to do this at this time. Like I just always thought that's how it was. Now that may be true for pre-clin, because pre-clin you have an actual lecture schedule and you have this time with this consultant and whatever. When you get to clinicals, they don't have none of that. Like certain rotations, I would say at our school they might be a little more structured. For example, psychiatry, you know where you're supposed to be on most hours. Like at 9 o'clock, you know, you have ward rounds, and then 12 o'clock you have ATSU. Like they tell you where you're supposed to be for certain rotations. I think what else? Psychiatry, emergency medicine is another one that's you know, particularly like, you know, they might tell you, okay, Monday you have this clinic today, not clinic. Monday you might have a session with the consultant on a specific topic like that. But for the most part, most rotations, they do not have that type of structure. I think the most you will ever get is like, to structure, I mean, is like, for instance, you might have clinic on a Monday. And if you're on surgery, they might have 2 OT days. So Thursday is your operating theater day and Friday is your operating theater day, right? But other than that, nobody is telling you anything. You have a procedure sheet, and I will probably put an example of one of our procedure sheets. So you know that at the end of the clerkship, you're supposed to hand in a procedure sheet. That is supposed to be your, basically like telling you, okay, when I go to school today, this is what I'm trying to work towards. So when I just started, I think I was a bit like, so nobody gonna tell us when they're doing a lumbar puncture, nobody gonna tell us when they're taking blood and stuff. And then I realized you just have to be proactive. You have to go and look for the residents and look for the interns and say, hey, when you're doing this, could you just, you know, poke my shoulder so I can come and like things like that. Because if you're not looking out for yourself, trust me, nobody will. It's not as if like they don't care, and I really say that because sometimes it appears that they don't. But I don't think it's that they don't care. I think it's that everybody is busy, and all of those doctors have already passed that stage. So in their eyes, it's just like, no man, you're a medical student, you're supposed to know that you have to go and do this and that at this hour. So for me, every day I go to school, I may not have a specific goal in mind, but I know I am not wasting my day. Especially now that I'm going to school all God's back hour. I make sure I clerk a patient a day, and if I don't clerk a patient, I make sure I examine. If I'm not examining a patient, I'm doing some form of exam preparation with my friends. So whether that be we do counseling stations, we do actual examination stations, we do technical station practice, we interpret a chest x-ray, we interpret a ECG. I'm making sure every day I go to school it counts, and that when I go home I at least learn one thing. Because guess what? Exam gonna roll around and you're gonna be in that OSCE station and the consultant is gonna be like, so why haven't you seen this? And you cannot say, oh well, we just never see it at that side, because guess what? Somebody from your side would have seen it because they have been proactive. You understand? So you really have to check for yourself. Like at the same time, you know, you have a friend and you say, wait, they're doing something now, so there we go and watch that. Yeah, you check for people, but at the end of the day, you gotta check for yourself. That is just the reality of it. You gotta be proactive, because really and truly, you that paying for the degree and you paying for yourself to become a doctor. Check what I'm showing you. So all that to say, you know, be proactive. When you actually go to school, try your best to like befriend a consultant. It's not the consultant, don't do that. Try to befriend a resident or another student who is as proactive as you, or one of the interns that's doing a lot of the work that's on the procedure sheet. Try to talk to them and say, hey, I want to. Or sometimes just stand up by the room. Sometimes I just do that. I'll literally just stand up by the room and the treatment room until I see them coming in with a patient, and I just ask to help out and stuff. So yeah, you really have to look out for yourself. That's one of the things that I think people can warn you about, but you have to really experience it and see like, yeah, I have to check for myself. Alright, so number 4 is that OSCEs are extremely nerve-wracking, but they can be your best friend. Now let me explain. So for those who don't know, an OSCE stands for Objective Structured Clinical Exam. So when we went pre-clin, we had 2 sets of exams. We had MCQ and we had a spotter. Now I never got to experience an in-person spotter just because of COVID. But a spotter is basically like, it's 100 questions and you walk around a room with a bunch of cadavers and cadaver parts. So if it's respiratory system, there'll be a bunch of lungs, a trachea, there'll be lung anatomy, basically respiratory anatomy in that area. And they put a pin and they tell you identify the structure, what does it do, associated blood vessels, so and so. Now, that is like an introduction to a clinical exam, but it is nothing like what an actual OSCE is like. So an OSCE can take different forms, but the general form of an OSCE is that it is an examination station that is 5 minutes long, and it is supposed to be an objective means of determining whether or not a student is clinically adept in a particular area of that rotation. So for instance, I'm on pediatrics right now. A consultant can say you have 5 minutes to perform an abdominal examination and you have 2 minutes to present your findings and give me a differential diagnosis, investigation, and your management for this patient. Now think about it. You have 7 minutes to examine somebody and figure out a plan for them whilst also trying to figure out what is going on with them. It's unrealistic, right? However, they're trying to just see if you're actually like, you have the skills to elicit the findings if you had the time. That's not to say that you cannot actually elicit findings in a 5-minute exam, because you'll be surprised that sometimes you can just look at a patient and they tell you all the time. You don't even have to, you can just look at a patient and just tell what is happening, especially if you've been seeing that same thing all along. So some of the other forms of an OSCE you can get are like, you can get a technical station where they ask you to suture a wound. They can ask you to, not on a real patient by the way, they can ask you to suture a wound. They can ask you to do a BLS resuscitation station, along those lines. And then you can get the non-physical aspects of an OSCE, which are like your vivas. So a viva is basically like, a consultant asks you a question and all you have to do, it's almost like pimping but in the actual exam setting, exactly like that. So the consultant would show you a picture and he would say, what do you think of this? And then you would say, okay, well, I think it's the middle ear cavity, and I'm thinking about my ENT OSCE, by the way, because the ENT OSCE is a viva. And he says the middle ear cavity, I think this is in keeping with a cholesteatoma, whatever. So you have those vivas where you're not using your hands, but you kind of just have to talk. All in all, it is different from any form of examination that you would have done in the past. Because for CAPE, you really just have your written paper and then your MCQ, right? But this time around, you don't have that. Like, you just do an MCQ and you have to actually like work for your marks and stuff. So the reason why I say OSCEs can be nerve-wracking is because think about it, bro. 5 minutes to do basically a full examination of a system when a system has a lot of different parts all over the body. It's wild, right? And then you only get 2 minutes to present and actually come up with a diagnosis and stuff. So it is pretty nerve-wracking, especially because the consultant is the one who is examining you, and this is somebody who knows everything about that topic. Basically, they went to extra school so they could know about that. So people like you don't want to run the risk of looking stupid, or sometimes they just don't even want to try because they think it won't make a difference. But let me tell you why OSCEs can be your best friend, spoken from somebody who loves doing OSCEs. It sounds a little sadistic, but let me tell you. So as we know, most OSCEs can run from like 30 to 50% of your grade, right? It's a big chunk of your grade. So if you're somebody who is not a really good test taker, like an MCQ taker, you tend to like doubt yourself, you may not like feel confident in your answers, OSCE can really help you because you have the information in your head, and chances are you're gonna know what they're gonna ask, especially if you prepared, right? But if it is something that you didn't know and the consultant sees that you're actually trying and you really know the basis of the information, 99% of the time they're not gonna lead you down a bad road. There's one of consultants that just they hate seeing people like not know stuff. But for the most part, they understand you may be nervous, you may not have viewed the information in a little while, but you were on the ward, you saw it. They want to work with you, trust me. So I think, using that to your advantage, you can really try and like bring up your grade and stuff in a situation where you may not have performed well on the MCQ or your ward assessment was not the best. So I think a lot of people shy away from OSCEs, and really and truly OSCE is an art. It is an art that a lot of us have to learn to perfect. I myself, I'm trying to really like just perfect my OSCE skills, especially because next year for final MBBS, it's a big OSCE. We get a 17 station OSCE and we have to actually do well on it. So it is an art that you have to just get really good at, because they like to say an OSCE is like a show. But when you think about it, if you learn the skills really well, you will actually be able to elicit things well on patients. So it's something that we shouldn't shy away from. I think we should really try to, hone in on our skills, our OSCE skills, and it can help you in your grades, bro. It will help you do better. But I don't think anybody can prepare you for what an OSCE is like. It is nerve-wracking. No matter how well prepared you are for an OSCE, there are just certain OSCEs that are just particularly difficult, and some other consultants are scary. So yeah, that's one of those things you kind of just have to see it for yourself to know. All right, and last but not least, the fifth thing that nobody can really prepare you for is that you cannot do this alone. You cannot do this alone. So you see all the lone wolves, all the I don't really like to study people, or I don't like study groups.
Cut it out. Cut it out.
Cut it out. Cut it out. You cannot do it again. This is not fifth form, this is not CAPE, this is not pre-clin. You cannot do it anymore. And let me explain. So when you get to clinicals, you will realize that the volume of work is pretty much the same, because a lot of the information from pre-clin is the same, right? However, when you get to clinicals itself, you realize that you have a lot of learning to do. And I say that in the sense that you're learning a lot of clinical concepts. Even if it's a topic that you would have known extremely well, you have to know how it applies to a patient. And I think a lot of the big things that we don't really learn in pre-clin is management of patients. And rightfully so, we don't really need to know that at the time, right? So I think one of the things they really stress is anatomy and physiology and a little bit of pathophysiology for the illnesses and stuff in pre-clin. But when you get to clinicals, the stress is really investigations, management. Like, how are you gonna manage this patient in real life? So that is a big aspect of learning, and I think it is something that adds to, because so think about it. You have the pre-clin knowledge and you have all this stuff that you need to sometimes relearn. Like it may look like you want to revise it, but some other concepts you have to relearn. But now you have this added mountain of investigations, management, and you have to learn specific management in Jamaica or at the hospital that you're at. So that being said, it is a lot more work, right? Technically, it's a lot more work. But when I was in pre-clin, I think in first year I kind of did the lone wolf thing. Second year I did a little bit of study group, but by the time like the beginning of third year started, I was kind of back to my lone wolf thing. I just like studying by myself. When I got to actual clinicals, I realized I couldn't do it anymore. Like, I was starting to realize like there was just way too much stuff for me to learn all on my own. So the downside about clinicals is that you're not always going to be on rotations with your friends. However, you can find a study group within every rotation, and that's just the truth about it. You don't have to be on a rotation with your friend. You can make friends on your rotations, right? So what I started noticing is that every rotation I would find like a group of like 6 or 7 of us, and we would like start doing OSCE prep from early. And I can vividly remember so many times that this has helped me in an exam. Let me give you an example. So when I was on emergency medicine, I remember the night before the exam, there was a guy on my flat. He's in final year now. He's preparing for MBBS. But at the time, he was doing his final year rotations, and he told us, make sure you know about chest tubes. So I said, oh, like I knew about chest tubes from like, you know, third year, fourth year, but like a little bit of fourth year, but I didn't really think it would have come as a station, you know, like even though I know it's very important for EMED, in my head I was just like, why would this come as a station? So I was reluctant because it was getting really late and I don't like missing sleep for exams, but someone just say, okay, let me just sit down and listen to him. So I didn't really know much about the topic, but I just knew basic things. But like I was listening to them talk and I was like, okay, I mean, you know, you learn a little bit. Lo and behold, my second station in that OSCE the next day in the morning, it was like 9 o'clock, chest tube. I walk in the room, I knock on the door, I said, good morning, my name is Gordon for look on the ground, underwater seal. And it's like this light went off in my head and I was like, yo, if I went to bed 5 minutes earlier that night before, I would have been screwed. And it's like, even though you have a lot of stations in the OSCE and like you have a certain number of them, you can fail before you fail the whole thing. It's like you don't want to fail a station. Nobody wants to fail a station. You don't feel good. It messes you up going into the next station. You want to just do well on all of them. And I was just so grateful. Like the night before, I was just like, if we did not have this study group, I would not have known this. And that wasn't just that one instance. Like almost all my exams, I can recall either a study group experience or an experience with an actual patient that helped me in the exam. So that's to say, one, go to school and learn. But two, study groups really help. Like I don't know if that's not a testimony enough. I don't know if I need to tell every single experience I've had like that, but trust me, the study group stuff, it really works out. And another thing is, like I was saying, some of the concepts you may not be able to cover on your own, but a classmate of yours would have covered that because they prioritize that. And they say, guys, let me just teach you a little bit about aortic regurgitation, let me teach you about some murmurs. And you say, okay, let me just listen to them for 10 minutes. You learn the topic. And then you go into exam and then you just say, oh yeah, I remember what so-and-so was saying. So yeah, I mean, hey, if you don't want to listen to me, that's on you. But I'm trying to give you all the real, I'm trying to give you all some good advice. And yeah, that's just how it is. I mean, people will tell you beforehand like you need a study group, but I think a lot of people who are lone wolves will disregard it. But you will see for yourself. You will see for yourself when you reach. Thank you so much for watching this video. I appreciate so much if you got to the end. I hope you enjoyed it as much as I did making it. And I just want to say that everybody's experience is gonna be different in clinicals. Like every single second of the day is gonna be a different experience for everybody. But I think this is pretty useful advice, or just, you know, just me giving my testimony about my experiences. Because even though, like I said, even though somebody can tell you about it beforehand, you wouldn't really know about it until you actually get through it and experience it for yourself. So hope you hope you enjoyed again, and I will see you all in the next one.
Today I did good. I ain't been eating no bullshit. In fitness, I wake up, I feel fit, and thank God every morning I'm still rich. Open your eyes, see the